they are considering getting a genetic test done, but they want to understand about the implications of undergoing a genetic test report. So the first and foremost what we do is take a 3-generation family history. This is very, very important for us to assess whether just a BRCA1 or 2 is required for testing, or should we explore and include other genes as well. This completely depends on the family history, the ages, diagnosis of various members in the family, what kinds of cancers were they diagnosed with. So we try and get as accurate information as possible with respect to the family history. Then we interpret information, medical information, and explain to them and educate them about what do these risk factors mean, what are genes, what is inherited cancers, and we also give them the space and time to ask any questions that they might have about genetic testing process itself. If they're unsure, there might be a lot of anxiety, especially where there are families with extended family histories. There's a lot of anxiety, there's a lot of high perception of risk by default. So a lot of the times it might be helping them unlearn a lot of Google facts and information that they have on, and also be there as a support system for families. There's a lot of underlying psychological issues as well that play into their decision making, and what really helps them figure out and make a decision that is important for them, for family members as well. So I think the 3 key areas that a genetic counselor plays a role is in educating them, interpreting what these test results, what their own medical history means for them, as well as providing that support system. Because going through this, going through a journey, through a diagnosis, going through treatment is extremely difficult. And they also need to have that space to be able to just ask questions as they might have. So that is essentially what a genetic counselor does. And even when we see patients in a post-test setting where they've already undergone a genetic test and they come to us with the genetic test report, we essentially interpret whether it's a positive report, whether there is an uncertain significance, a variant of uncertain significance picked up, or even if it's a negative report, but yet there is a significant family history as well as personal history. So all of that needs to be interpreted, and what we do is have a personalized approach to every patient. It's not a blanket approach to everyone. And so I then talk to the medical oncologist, surgical oncologist, and the molecular department to figure out what is the best way forward for that patient as well as the family.